I mentioned blood sugar to my tia, and she's telling me I should try this herbal stuff. I don't know what it is, but she gets it from the Mexican farmacia. I'm thinking about maybe giving it a try, but you know about diabetes. Once you got it for life.
Well, given your experience with your brother, I can really understand how you could think of diabetes as a disease that you can't control, you can't do anything about. But if you could try to keep in mind, we know so much more about diabetes than we did when your grandparents were ill. And even now for your brother, and especially for you, we know that if you exercise, if you lose just a little bit of weight, or if you take medication, you can really lower the blood sugars. And that's what prevents you from getting the eye stuff and the kidney stuff and all the bad things we associate with diabetes. In fact, over this last year, I've had a couple folks like yourself who are newly diagnosed diabetics. And we did have to start them on insulin, but over the course of the year, they've exercised, they've watched their diet, and they've gotten off it. So there really is a lot we can do. You really can control your diabetes. I really want us to work together on this. Diabetes is it is a disease that you have for life, but you really can control it. So I'm going to be giving you a prescription and some paperwork today. If there's something I say that doesn't make sense, please ask me. I don't want you to feel overwhelmed by this. We're going to take it in small pieces, okay? So the first thing is I'm going to write you a script for a medication. It's called metformin, and for now we'll just start it once a day. What it does is it actually lowers the blood sugar that's in the blood vessels, and that's important in diabetes, to keep that sugar low. The second thing, I'll give that to you. The second thing is that we know that exercise will lower blood sugars, and we know just a little bit of weight loss through watching what you eat lowers blood sugars. Sometimes I know that people get overwhelmed when they try to do too many things at once. So I'm wondering if you have a preference for either maybe starting an exercise program, or if you're not ready to do that, if you'd be at all interested in, I hate to use the word diet, but just watching your diet and working on dietary issues.
Well, I've been wanting to exercise anyway, and I'd rather do that than the diet thing, so.
Well, that's great. Let's focus on exercise then. What type of activity do you like to do?
Well, I used to play football in high school, so I guess I'll get into running.
Okay, that would be great, as long as it's something that you really enjoy. Okay.
Sounds fine.
And then I'd like to see you back in a couple weeks, and then I'm going to give you a little bit more laboratory things to check at that time. I'll explain it to you then, and probably some more referrals. But again, I want to just start slowly with this, okay?
Okay.
And the other thing is, and why don't you bring in the herbs that your aunt had told you about? I'd really like to see those, and we can look at them and see if it's something that we feel might be helpful for your diabetes.
Sure will.
Okay, I'll give you these. There you go. And and you know what, the other thing is, if you have a family member, someone that you'd like to take to the diabetes education classes, in my experience, it's really helpful to bring someone from your family for support.
I'll do that.
Okay, wonderful. Well, I'll see you in a couple weeks then, and we'll talk some more then.
Thank you, doctor. I'll see you in a few weeks.
Okay. Okay. Hi, Mr. Lopez.
Hi, doctor.
How are you feeling today?
Well, I feel better. I've been taking my medication. My wife and I have been going to the diabetes courses, as you suggested.
Wonderful.
I'm a little nervous about them, but I'm getting better at it. My blood sugar, I'm keeping it below 200, and I'm starting to walk somewhat. And my wife, Sarah, is joining me as well to give me some encouragement.
Oh, that's great.
In this video clip, you saw the 3 approaches to the medical office visit. The standard medical interview using the Sacred 7, the beliefs model, and the ethnic model. The Sacred 7 questions served to uncover more of Mr. Lopez's diabetic symptoms, but did not address how he felt about having diabetes. The beliefs model used questions that revealed that Mr. Lopez felt very helpless about his diabetes. He did not believe that diabetes was a disease that could be controlled and had many negative experiences with ill family members. The ethnic model also asked questions about Mr. Lopez's belief system, but this model went further, including the very important step of negotiating a plan. Ultimately, the doctor in this scenario was most effective when she understood the patient's concerns about his disease and addressed these concerns. Addressing his concerns did not take any longer. Each scenario took approximately 3 minutes. We encourage you to expand the questions that you ask your patients so that you too can achieve favorable treatment